Another thing our patients like about our office is some of the technology that we use that makes their lives easier and makes my treatment better. We've used digital x-rays since 2001. I think I was one of the first offices, if not the first office in the Pioneer Valley, to use digital technology. With the digital x-ray, the x-rays are actually rounder, they're more comfortable. We get an immediate image and we can actually see on the screen immediately whether we have the view that we need. And I can do things to that view, change its colors, invert its colors, change its shape, and I can really see things much earlier in the process. I certainly can also circle things on the x-rays. I can use it for communication with not only patients but specialists to really get a better result for my patients. We use the intraoral camera, small digital camera, we place it in the mouth, and I use that as part of my exam process. I can see so much better when I have the camera, the lighting from the camera, having everything be larger. It allows me to diagnose problems earlier, when they're smaller, when they're less expensive, and when more can be done to help my patients rather than after something breaks. I also use my intraoral camera while I'm doing dental treatment. So as I take out an old filling, I take multiple pictures of the different stages. I use a cavity indicating dye on the tooth. I rinse that off. I take a camera picture to make sure that I've removed all the decay underneath an old filling. I can identify if there's cracks in the teeth at that point in time and make a recommendation to my patient on whether or not they may want to have a root canal therapy completed before we put the final crown on. That saves them from having to have a hole drilled through a perfectly good brand new crown when the nerve dies a year later, and it's something I really could see coming up because of the cracks running through the nerve. No one likes to hear that they need a root canal, but it's much better to have one done sooner rather than later. People like to come to my office because we're real people, we're down to earth, we like to talk to our patients, we like to find out what their concerns are, and we also love doing preventive care for our patients and teaching our patients how to take care of their own smiles at home. The most gratifying experience for me is when I have a patient who has had a lot of work done with me in the past, and they come in for their regular maintenance visits and their mouth is in fantastic shape. They are doing everything they need to do at home. There's no inflammation, there's no disease, there's no plaque, and they look fantastic. Please give us a call, schedule a tour. Come see the office, come feel what we do here, listen to the sounds of laughter in the office, and really get a sense of who we are and whether you feel like this would be a good fit for you, whether you'd be comfortable for me. I welcome you to come in and meet with me for a free consultation where I can discuss any specific concern that you have, and we can talk a little bit about what you'd like to have done, what the options are, and whether this is a good fit and if I would be a good match for you as your dentist. I want you to be happy here, and I want you to have a healthy smile that you can maintain for the rest of your life.